Hello, I'm Kelly. I'm very pleased to be able to present to you a quick snapshot of the ColoSSoS Project. Water Research Australia were commissioned to write fact sheets for the water industry on the pandemic before it even became a pandemic. This is where our interest in monitoring sewage for this COVID-19 pandemic stemmed from. We're very much aware of the current surveillance programs running in Australia, from chemical drug programs, such as those led by the University of Queensland, to the expert virus sewage surveillance programs being run by various labs around the country, including the National Reference Laboratory for viruses such as polio and other enteric viruses. The ColoSSoS project was developed highlighting four key phases. One, to ensure a national approach, to ensure reliable and robust information was being provided to health, to develop a structured system capable of fast scale up, and to facilitate research and development for the future. In phase one, the initiation, to ensure a national approach, there were many factors brought together, one of which was the connection of 4 expert working groups. The expert groups offer peer review as well as collaboration and fast development, ensuring that national experts are liaising and using the most reliable and robust methods and techniques and avoiding the replication of effort. I have highlighted in yellow here the laboratory responsible for many national virus surveillance programs. This is the laboratory that we have selected to be the reference laboratory for the ColoSSoS program. It's certainly not the only laboratory being used in the ColoSSoS program, and I'll talk about the value of multiple laboratories shortly. The innovative design of the ColoSSoS program has an established state node structure, gathering and analysing results and integration with epidemiology data in each jurisdiction before coming together in a national reporting structure to NHealth, the National Environmental Health Unit for Australia. And you can see in this diagram the before mentioned expert task groups in the centre. The node structure is hugely valuable. It brings together the expertise of water utilities who understand their sewerage networks and where to sample to capture a particular population, as well as laboratories undertaking molecular analysis who understand any limitations to test methods and data, as well as health departments to help provide advice on appropriate sampling locations and frequency, as well as data analysis. All parties are working collaboratively so that capability can be built in centres that currently lack local testing capability. The ability to process samples quickly and within state borders is important to the long-term success of the program. The ColoSSoS project has the formal support of the Water Services Association of Australia, and they're working with the NCCC for the resourcing of materials to support the ColoSSoS program for sewage testing, to scale up in a manner that doesn't detract from clinical testing priorities through competition for resources. The program has more than 45 partnered organisations. The expert task groups I described earlier have developed to include many utilities, health departments, laboratories and universities. The structure has also evolved to include commitment to partner from an additional health and epidemiology specialist group to integrate clinical test data with results from sewage surveillance and ensure appropriate timing and messaging of results so as to not cause alarm and to support the department's broader response communication. ColoSSoS has formal support from international partners, all of whom are undertaking similar surveillance work globally. These provide strong links to the equivalent water utilities, health agencies, including the US Centers for Disease Control and Prevention, and preferred scientific providers for ministries of health globally. So progress so far, ColoSSoS laboratories around the country have succeeded in detecting viral RNA from the SARS-CoV-2 virus in sewage. They have confirmed the validity of their results through genetic sequencing. To date, approximately 1,000 samples have been collected during the pandemic peak by the ColoSSoS Project. The ColoSSoS Project will continue to run the national collaborations through our state nodes, continue to sample, analyse and report to health departments using the additional funding already secured from health departments. An integral part of the ColoSSoS program is the guiding principles. All partners who sign up to the program are committing to adhere to these principles. The principles listed here have been developed in collaboration internationally with the Canadian Water Network. They require that partners adopt a collaborative framework, that all research and activities conducted are in direct response to end user needs to support public health decision making, and for open sharing of ideas, thoughts and learnings. The work conducted in this program will not be used for commercial gain or unduly delayed in the pursuit of publication. So that provides you a very quick snapshot of the Water Research Australia ColoSSoS Project for Australia and New Zealand. I know I'm running out of time. I've added this slide with some quick thoughts on how our experiences might differ to those of a European collaboration. For instance, the governance of states versus countries, how reporting of health data could be achieved collaboratively across multiple nations. The difference of case numbers. Australia and New Zealand have been very fortunate to have not as many COVID-19 cases in the community. And how does this affect our molecular methods in terms of reaching the limit of detection? Also, the potential differences between combined and separated sewerage systems, and potentially seasonal differences. We know coronaviruses in general, and particularly the SARS family of coronavirus, are particularly sensitive to temperature. And so the persistence of the virus in sewage, particularly in South Australia and Victoria, the cooler states of Australia, as well as New Zealand, could provide some key insights into this persistence. It may be valuable in the coming winter months, when hopefully the case numbers in Europe are also as low. Lastly, I mentioned the whole way through, but WaterRA believe that having the health departments involved, driving and actively participating in the program alongside our utilities is absolutely critical to the value and the quality of results that we get from this type of sewage surveillance. I'd like to thank you again for letting me speak today, and I've added my email address here. If you have any questions, please feel free to get in contact. Thank you.